A 3-unit bridge can be a good choice for replacing it. In a 3-unit bridge, an artificial tooth is connected on either side to crowns, which are placed on the neighboring teeth to hold the bridge in place. A 3-unit bridge can be made of gold, porcelain, or porcelain fused to metal. It's custom made for you in a dental laboratory, so it may take 2 or more appointments to complete your bridge. On your first visit, we numb the area to make you comfortable. We may also use a rubber dam to protect your mouth while we work. We remove any decay and use the handpiece to shape the teeth that will support the bridge. Then, we'll take an impression of your teeth. The lab uses the impression to make a model of your mouth. They'll use the model to create a bridge that precisely fits your teeth and bite. In the meantime, we often place a temporary bridge. On your next visit, we remove the temporary and begin a series of steps to confirm the fit of your new bridge. When we're satisfied with the fit, we try in the final bridge, checking the fit and your bite. When everything looks good, we cement or bond the bridge in place. 3-unit bridges have several advantages. They replace teeth for biting and chewing, assist in clear speech, help prevent teeth from shifting, and the crowns can also serve as restorations for anchoring teeth that have damage or decay. When you need to replace a missing tooth, a 3-unit bridge can be a functional, good-looking solution.
Sometimes the best choice is an all-porcelain crown. It has the delicate translucency of your natural teeth. An all-porcelain crown has several advantages. It's strong and durable. It has the lifelike appearance of natural teeth. And because there's no metal, it's a good choice for front teeth. The crown is precision crafted in a lab, so it may take 2 or more appointments to restore your tooth with a porcelain crown. On your first visit, we'll choose a color that matches your natural teeth. We may also use a rubber dam to protect your mouth while we work, and we won't start until we're sure you're comfortable. Then, we remove any decay and shape the tooth with the handpiece. Next, we place a small impression string between the tooth and gum to gently push the gum away. This step helps us get an accurate impression. When the area is ready, we'll remove the string and then take an impression of your teeth. The lab uses this to create a crown that precisely fits your tooth and bite. In the meantime, we often place a temporary crown. On your next visit, we remove the temporary and try in your new porcelain crown. And then we cement the crown into place. When you need a crown, porcelain crowns are a natural-looking choice for a beautiful and healthy bite.
When a tooth has a cavity, or you need to replace a worn filling, a natural-looking restoration can be a beautiful choice. White fillings have several advantages over silver fillings. They're bonded to your tooth, making it stronger than if we used a silver filling. We don't have to remove as much tooth structure as with a silver filling, and the bonding agent used can insulate your tooth from extremes of hot and cold. Some white restorations can be done in just one visit. After we remove the decay, we can build layers of the resin directly onto your tooth. We use a special light to bond the resin to the tooth for strength. A larger cavity may need an indirect restoration. We'll remove the decay or the old worn restoration. The restoration will be created in the lab to fit your tooth precisely. Once crafted, we'll bond it to your tooth for strength. It'll take 2 or more visits to get this kind of restoration. White fillings can be a great choice to give you healthy teeth and a beautiful, natural-looking smile.
Untreated deep cavity infects the blood and nerve supply of a tooth. As a result of this deep infection, the tooth may become severely painful. Depending on the severity of infection, root canals may require 1 to 2 visits, not including any follow-up visits. To treat the infected nerve, the dentist must first gain access to the inside of the tooth, removing all the decay. Then, each tiny canal inside the root system must be identified and cleaned out of its infected tissues using small, tapered instruments called files. Once the hand filing of the canals is completed, the canals are further prepared using rotary instruments that open up the canals to a precise taper and length. The canals are then each filled with an inert, flexible plastic material called gutta percha that seals off the canals from any further bacterial invasion. To add structural stability to the tooth, the canal spaces may be further prepared to allow for the placement of reinforcing posts in the tooth. The posts are now placed in the prepared space. Finally, a dense filling material is injected into the tooth cavity. The core filling is then packed and shaped to resemble the bite surface of the tooth and cured to hardness with a specialized blue light source. To minimize the chances of breakage or fracture, it is highly recommended that a crown be placed on the tooth. The crown is usually placed as soon as possible.
Prosthesis is the complete replacement of all the remaining natural teeth with artificial ones. Hence, total prosthesis is used on toothless jaws and serves the purpose of restoring chewing ability and aesthetics. A total prosthesis is often described as dentures. The retention of a total prosthesis is achieved through adhesive forces between the mucosa and the prosthesis. A saliva film is located in between the prosthesis and the mucosa, similar to a water film between glass boards. Therefore, during prosthesis production, it is very important to create optimally sealing prosthesis edges. Otherwise, the prosthesis would fall out every time the mouth is opened. Prosthesis designs can vary greatly. The designing process starts with the selection of the prosthetic teeth. In the top of the picture, you see cheap teeth, and on the bottom, you see expensive teeth. In both cases, the teeth are made of plastic. However, ceramic teeth are sometimes used. Plastic teeth are more cost-effective for the dentist and the technician. Contemporary plastic teeth can provide better and cheaper results than ceramic teeth. Another important disadvantage of ceramic teeth is that they will break immediately should the prosthesis ever fall out of the mouth by accident. Often, transparent gums are produced as well, called clear gums. You can clearly see the probe shimmer through, the same way your gums show when you smile. This is supposed to create a less artificial appearance. Furthermore, this prosthesis was equipped with a gold grid for improved stability. Incorrect and/or overstraining of the jaws due to poorly fitting prosthesis can lead to increased jaw ridge reduction. This frequently results in inadequate support. To reduce the prosthesis pressure as much as possible, the base has to be supported by as large an area as possible in relation to the chewing area. Tooth installation up to the sixth tooth is completely sufficient. It can handle the stress involved between chewing pressure and the prosthesis base. However, since the patient usually pays per tooth, the prosthesis is often extended to the seventh, and occasionally even all the way to the eighth tooth. Despite the various types of prosthesis, a total prosthesis remains a compromise solution. Fortunately, nowadays, most patients are spared from having to use a total prosthesis because of bone construction surgery and tooth implants. More about that in the videos on bone construction and tooth.
Teeth in an arch are missing? A partial denture is a good treatment for replacing them. Partials are removable appliances that are held in place by clasps that fit around some of the remaining teeth. The first step in placing a partial is to shape the supporting teeth. Then we take impressions of your mouth, including the prepared teeth. An accurate model of your mouth is made from these impressions, and the lab uses this model to create the denture framework. In some cases, a wax rim is mounted on the framework for you to try in. This helps confirm the correct relationship between the upper and lower teeth. The lab then creates a wax replica of the final denture, called a wax-up. Depending on the circumstances, we may have you try in the wax-up, and we'll note any changes to the fit of the base and the color, shape, and placement of the teeth. We then send it back to the lab, and they process it to create the final denture. When the denture is ready, you'll try it in, and we'll make any necessary adjustments. Partials have many benefits. They help stop your remaining teeth from shifting. They also balance your bite, so you'll chew better and have a healthier jaw joint. And they provide support for your lips and cheeks, which helps you speak clearly and look your best. With proper home care and regular adjustments and relines, your partial denture can provide a functional bite and a natural-looking smile.